transforming healthcare. Since I was a young pup in healthcare, a resident, med student, fellow, early in my career, it was clear to me that we had some work to do in the healthcare system. I wasn't okay with sitting on the sidelines. So you guys have been part of this journey. The original show is called Solving Healthcare. We talked to experts on ways to innovate. And we started really to take off during the pandemic about trying to create that balance. Then we found ways, the deficits that we were seeing during the pandemic and highlighting the inequities, the lack of preventative health, and dawn came prevention over prescription. So one of the new directions I want to take on my platform is I want to take you through the journey of how we are going to transform healthcare. It's become abundantly clear to me that we're in an opportunity right now to change the boogie, to move the needle. And I think navigating that, seeing our journey will inspire. It will allow you to have hope. It will allow you also to be part of the solution. And so I'm going to just walk you through a few steps that we're doing to try and make this happen. So number one, as you guys know, the show's called Prevention Over Prescription. And my mission is to help people avoid seeing myself or my colleagues in the ICU. And we're doing this several ways. This is through the podcast itself, the books, the social media content. But how do we do this at scale? And so what we've developed through the book was the PRESS methodology, focus on what's your purpose? How do we restore you and reduce your stress? Eating well, strength and exercise, and the last S for social connection. And through this coaching, we're able to help patients and clients navigate the complicatedness of health. And we're doing that through MindStride. But more importantly, we also want to be able to do this at scale. So we've been applying for grants to be able to do this in cancer patient population. For those that are waiting, older patients that are waiting for their surgeries, for those that have had heart issues. How do we do this at scale? How can we involve our youth that are at risk of obesity and prediabetes? How do we do this and teach this so that that teacher can say, hey, what is your purpose, little Jimmy? What can we do to reduce your stress? How do we get you moving throughout the day? Let's do some high intensity activity before the school day starts. Let's do a little bit of strength training. And let's make sure that you're playing with your friends, even no matter what time of year it is. So how do we implement these simple principles at scale so we influence change, influence outcomes so that they prevent people from landing in ICU in the first place or needing acute care? Your mom is waiting to go to surgery for her hip. Let's get her on the PRESS tip. Let's get her on the PRESS methodology so that she is not one of these patients that can't get to their baseline after surgery. Let's focus on the ways to get you healthy so you don't have that complication. Let's get you off your diabetic meds before you have that foot ulcer, heart problem, kidney problem, brain problem. This is the magic of prevention, and this is what you're going to see us navigate through. Applying for grants now, the research team is really putting an emphasis on that. So this is what we're all about. Second high-level thing that we want to tackle, access to care. 20% of y'all don't have family doctors. How do we approach that? This is one of the main reasons I'm working with MindStride. Looking at ways that we could democratize primary care, democratize mental health services. And so at a reasonable rate, you have access to primary care, virtually or in person. This is changing the boogie. Because I'll tell you, I've seen on a regular basis the impact of not having a family doctor, the impact of not having access. I've seen it where patients have a minor complication and are too afraid to wait in an emergency room. And that leads to, I've seen people with bad tooth infections lead into their neck where we couldn't even, where we had tough time securing their airway. I've seen people that have left infections in their lower limbs lead to flesh-eating disease and having to lose their limb. So this stuff is real. And to me, the solutions are not as complicated as we need it to be. For example, leveraging virtual care so that if you are anywhere in this country, you have access to a family doctor. It doesn't matter where you are. We should have national licensure. I should be able to help out in New Brunswick, Alberta, British Columbia. Because I'll tell you, the intensive care skills is not changing from province to province. So how do we leverage that? How do we leverage our international medical graduates to be involved in healthcare? Maybe they don't get a full license, but you can't tell me they can't find a role in healthcare. I saw recently a fully trained surgeon training again from scratch. This is not where we need to be when access is an issue, when surgical wait times are not reasonable. So this is what I'm involved in. I'm involved in leveraging technology. I'm looking at companies that are using AI or monitors that could allow you to stay home or stay in your place of residence and get early access to care so that you don't have to land in hospital. Imagine your wearable is going to tell you you're sick before you're sick. That's where I'll get excited. I'm talking to a company, Easton Sorum. I love these guys that are using patches to be able to do blood work and to monitor you. Imagine you don't have to get poked. Your iPhone will tell you what your blood sugar is, will tell you what your blood counts are. Like, that's the future. And this is the stuff I want to get involved in. I want to highlight these companies. I want them to put them on the table till they get access to the best experts so we could change the freaking boogie, because it needs to change, son. This is what we're all about. And you're going to witness this journey, guys. You'll see me promote some awesome brands that are doing similar things what I love is like brands that give you little nudges that could give you big impact. Apollo. I love my Apollo Neuro. Do a session with Apollo and tell me your nervous system ain't more relaxed. Shout out to Dave, Dr. Dave. You're killing it, buddy. We started our own supplement line so people knew they were getting high quality protein, high quality collagen, high quality creatine, that you don't have to second guess the source to make things simple. Does everyone need to be on supplements? No. But if you're going to go to a supplement, GAD is your baby, so you know what you're getting. This is how we're involved. Yes, I am an intensivist. Yes, I am the department head of critical care at the Ottawa Hospital. But that's not my only box. And the reason it's not my only box is because we're looking for impact. We're looking for change, and it needs to happen now. So this is the content I'm saying. You're going to witness those meetings. You're going to witness those new ideas. You're going to witness these companies that we're working with that are moving the needle. This is the direction I want to see us go. I hope it's entertaining. In fact, I know it's going to be entertaining. It's going to be inspiring. It's going to allow us to change the freaking boogie, because the boogie's got to change. Right, folks? I hope you enjoyed this. Stay tuned for more. Love all of y'all.